All right, I'm gonna show you guys how to put on an ostomy dressing, or how to change the ostomy appliance. What you're gonna need for that is the actual wafer. That's the part that goes on the patient, the bag. You're gonna need a measuring tool, unless sometimes if the person's had it for a while, they know how big to cut their ostomy. And then of course, a good pair of medical scissors to help cut it open. So I'll show you guys how to take the ostomy appliance off once I'm done actually putting the first one on. So, you know, you always wanna clean your hands and put on some gloves. This is not a sterile procedure. While I'm doing that, I'm assessing that ostomy. You want it to be like that nice beefy red that you can see. You wanna make sure there's no like wound areas or skin chafage around the side, because sometimes if that ostomy didn't fit well around, the appliance didn't fit well around the ostomy, it can cause some skin breakdown. So this ostomy looks nice and healthy. Now, this is what the wafer looks like. This is the top part. This is the bottom. So as you can see, this little hole is not gonna fit over there. It does have some measurements, 1 inch, 1.5 inch. This is where your patient may know how big it needs to be, but you can also see kind of that stop barrier, so you don't wanna go any farther. So for this one, I'm gonna go ahead and use my measuring tool. You can see there's different sizes, so as you put it on your patient, you can see which one is most appropriate. You wanna find the one that fits closest to the person's skin without actually touching the ostomy. So far I think that one's pretty good. That one's too small. If you look, this one's really close, but it's almost too small. It's kind of right there, but it's kind of tight. So I might go with this one, which has just a little bit of a barrier. Compare the two. Yeah, we might try that one. All right, I'm gonna hold this here and you guys can see it's just a little past that 1 inch mark. So that gives me a good gauge. It can be a little challenging to cut this, so you might have to do a couple cuts. Just try to make the edges as smooth as possible because this is gonna be against your patient's skin. I'm gonna go out a little bit more because remember I said it was a little bit bigger than that 1 inch. Okay, let's see if this fits. No, I wanna go a little bit bigger. And you can hold it up to it a few times if you need to. But remember that skin may be sensitive around there if some stool has touched the actual skin. All right, that's better. I'm just gonna even up this edge. You guys can see it's kind of a trial and error kind of thing. There we go, I like that. So after you've cleansed the skin, usually it's just soap and water. There are some specific stoma powders or creams that you can use, but make sure it is stoma specific. Then you are going to take off this plastic right here. Place the ostomy down. And then you would pull off this paper part right here on both sides and secure it. I'm not gonna do that just so it doesn't secure itself to the model here. Then you wanna take your appliance bag, put it whichever way. So as you guys can see, the stool is gonna likely come down, so I'm gonna put the bag that way. And you just wanna make sure it's nice and clamped on. It's gotta be clamped on really well. You wanna make sure you empty these bags based on policy of your organization. Usually it's within about 1/3 full because you don't want this to be completely filled up. Sometimes it fills up with air and you have to do what's called burping the bag, so you may have to open it up. You squeeze it to open it. There it goes. And release some of the air. This is also how you empty it. So you would empty, drain some of this out, and then close it. Some people reuse their stuff, but not all of them do. So once you have completely done that, if I want to remove the bag, because maybe there was some leakage, all you do is pop it right off. like that. But let's say we have to change the ostomy because maybe there's some leakage around the side. You just want to be very cautious as you remove it from the patient's skin, just because frequent removing and putting back on of something sticky can actually cause more skin breakdown. And now you would again clean it and be ready to measure your site.